statement. As you know, for the past 4 weeks, we've discussed breast cancer. We had one man to come on, Mr. Lance Stevens, to talk about men having breast cancer. But today will be our last wrap-up for the month of October. We're going to be talking to some wonderful young women who've experienced a traumatic disease in their lifetime. Some brave women who have dealt with breast cancer. And as you can see, they are with us live, well, and healthy. And they're going to kind of tell us about their story and what it was like for them as they experienced breast cancer. So before we begin the show, we're going to actually ask each one of them to introduce themselves to us so that then you will know who we're talking to. We're going to start with Dr. Gwendolyn Wright, who actually assembled this audacious group of women together to have this conversation, this real conversation. So, Doctor?
Hello, everyone. My name is Dr. Gwendolyn Wright. I am a breast cancer survivor. I was diagnosed with breast cancer in 2021. We're also in my building. This is the Well. We help with a variety of healthcare needs.
Hi, my name is Tamisha Hawkins, and I'm also a breast cancer survivor, diagnosed in 2006, and I was invited here, and I'm glad to be here today.
Hi, my name is Kim Graves. I was diagnosed in 2014 as a triple negative breast cancer patient, and right now I'm thriving, and I want to thank Dr. Gwendolyn Wright for inviting me here, so thank you.
My name is Gloria Young. I was diagnosed in October of 2022. I was diagnosed with triple negative breast cancer, which is very aggressive, and it was found very early, stage 1, with no lymph nodes involved, and I am a survivor.
And the reason you hear us talk about the type of cancer, triple negative breast cancer is a deadly disease that progresses so much faster than any other form of breast cancer. So when you hear the ladies talk about triple negative, that is a cancer that takes us out so much faster than any other form of breast cancer. So I'm going to ask the ladies to just kind of give you an idea of what it was like when you found it, Gloria.
I had a mammogram done early in 2022. 6 months later, it was time for me to have an MRI. The MRI is what found the breast cancer. The mammogram didn't. I also had an ultrasound done and a mammogram done the same day as the MRI, and the mammogram still did not show the breast cancer. It was a stage 1, was very early. I received chemo from November to April of this year. I had a double mastectomy done in June. So I'm progressing very well, and I just thank God that I am cancer free.
I know that's right. Kim?
Yes.
Let's talk a little bit about your battle and how you survived it.
Yes, well, actually, I was having issues and pain in my breast. I thought that it was just part of my cycle coming on.
Right.
And I went to go see my gynecologist. And I posed a concern. They indicated that I was okay, and I should just, don't worry about it, take Tylenol, I should be fine. But I know my body.
Right.
And I was an advocate for myself, and I pressed for them to give me a prescription to go get a mammogram done. Did that, and while I was at the facility getting the mammogram done, they asked us to do an ultrasound. They said they thought they saw something that was a little suspicious. So fast forward, there was a radiologist there, which he was an African American brother. He called me into his office and he said, listen, I'm not a doctor, but I can tell you, based on what I see, and from me to help another sister out, I want you to know that you may have breast cancer. That you have an early stage of it. Because I had probably like 4 little calcifications, little dots. And sure enough, I went to get a biopsy and I was diagnosed as being positive. When I first go around, I did a lumpectomy. They thought they saw I had another scare a few years later after I was diagnosed. And I just told my provider, let's just take them off. So I went through the process of getting a double mastectomy, followed behind reconstruction, and I'm grateful that I did.
And here you are today.
Cancer free.
Tamisha,
Yes.
let's talk a little bit about your journey.
My journey started at the tender age of 27.
Wow.
I actually found the lump myself. There's those little hangers that you put in your shower. You can get them from your doctor's office.
Right.
And years before, I had picked one up. Just today, I understand why. So I had one in my shower, and years before the diagnosis, I had started doing my self-breast examinations. And one day, I felt a lump. I was having sharp pains. Didn't know anything about it, so I didn't know what to expect.
Right.
Went to an annual checkup, and I remember the doctor was finished with me, and then I was like, oh yeah, there's a lump or something here that's been hurting. So she sent me to have the ultrasound and the mammogram, and just fast forward a bit, it was breast cancer. I was diagnosed with triple positive breast cancer, which is also a very rare and aggressive cancer from what I've been told. After the radiation, chemotherapy, I wasn't able to go and do the reconstruction right then because my doctor just didn't want to suggest it due to the diagnosis. So later I did go ahead and have reconstruction done. In the midst of the journey, it was rough. I ended up having a stroke. I also went into cardiac arrest. And these are two separate incidents.
So did they believe that that had anything to do with it because of the amount of chemo that they may have been giving you and the radiation that you had taken? Did they believe that that had anything at all to do with your stroke and your heart attack?
The stroke, they did after the test, when they determined I had a stroke, it was during the chemotherapy process. They said it was a blood clot that had pressed against my brain. When they went in to check and look for it, they couldn't find the clot. They don't know where it came from. They could just see the impression on the results from the test.
And when you were tested, what stage were you when you got your biopsy and all?
I was diagnosed with stage 2B metastatic breast cancer. And metastatic means that it is spread to quite a bit of my lymph nodes. So I had to have some of those removed as well.
And that was in
2006.
Let's talk a little bit about your journey.
Yeah, so my journey, it started in 2021. Of course, like I always say, we were out there fighting together, that great fight of the pandemic, where everything was different. Even the way we did healthcare was different. In 2021, I felt the lump. Me feeling a lump, I kind of ignored it for a while, but then I thought, like, I'm a healthcare professional, right? And I'm always encouraging people to, if you feel something different, you do something about it. And so I couldn't dismiss it. I wanted to, I remember even doing like advertising, oh my gosh, like let's go and do your mammogram too, because I knew I was a little bit over 40 years old, but the problem was I didn't have insurance at the time. And so I was like, oh, how do you maneuver this? Me being in the healthcare world, I had friends that were like nurse practitioners, so I had one of my nurse practitioner friends write me a prescription to get a mammogram, and then that first mammogram came back that I needed further testing. I didn't think much of it. I just thought like, oh, I felt a lump. They probably think you need something else. My husband encouraged me to keep going and get the next test, and so I did ultimately get an ultrasound, which came back a BIRAT5, meaning that there's a 95% chance that you have breast cancer. Nobody wants to think I have cancer. At the same time, we're young and we feel good. And we have too much going on. We're used to, like our grandmothers or great-grandmothers getting things like cancer and not even telling us what's going on, right? They got these ailments and we didn't know how they passed away or what they were going through. And a lot of times they refuse things like chemotherapy. So I was in that position where I didn't want chemotherapy. I'm like, wait a minute. All I knew is that you go through chemotherapy and then you die sometimes. So chemotherapy was an option that I did not want to take. It took me a while and probably too long to the point that my doctors was like, look, like either you're going to sign some paper saying you're refusing this or you're going to do the chemotherapy to save your life. One of the things I was worried about is, oh my gosh, my hair, it's just one of those things that we're used to having and used to having a little bit of control over. And so I decided to go with the chemotherapy because I had stage 2 estrogen-fed breast cancer at the time, which had already spread to my lymph nodes. When it spreads to the lymph nodes, that's like your last barrier. If it gets past your lymph nodes, that's when it can attack the body a whole lot more. So, of course, I did, like you did, get my lymph nodes removed, a lot of them removed. And I opted for the double mastectomy as well, just because it's a lot. I went through blood clots, kind of similar to you. I'm still on a blood thinner right now today because of the blood clots, and I had pneumonia. Just because the chemotherapy, it suppresses everything. And so one of the things that I did was got this organization, Fight Right Foundation, to help other people maneuver through this different world, because when you're going through, nobody wants to fight cancer alone. And nobody should have to fight cancer alone. So we're here, and we're all going to stick together, and we're going to help the next person, because unfortunately, it's not going to stop with us. I'm looking at cancer earlier. You were 27 years old when you got diagnosed, and you were 35 years old when you were 61, but you had a scare when you were younger, and you were able to catch your cancer at stage 1 because you went 6 months early.
I was also diagnosed when I was younger with fibrous cystic disease, which a lot of black women have, and now I also had dense breast. So any woman that's diagnosed with dense breast needs to definitely demand a ultrasound.
Right,
Yes,
as opposed to just getting the mammogram.
Yes.
Well, I can only tell you I've had that scare when I went in for my mammogram, and they sent me a note and they said, well, you need to come back for an ultrasound.
Yes.
And for the days that it took me to be able to get back for that ultrasound, I was petrified.
Yes.
I didn't tell my family that I was going back for the ultrasound for fear that maybe I was going to be diagnosed with breast cancer. Because they were like, oh, there's something abnormal with your mammogram. So that word abnormal really just sends you into a tailspin. And so when I went back to get the sonogram, and then they gave me the results, I felt a lot better. But for days, and nobody understands what that's like when you get that notice that, hey, you may have something wrong. And even though you don't know what that something is.
And I want to talk on that too, because I have so many people who are feeling something and they're scared. They're scared to go to the doctor. They don't want to know what it is. And I want to encourage you to
please
get that tested, because we have so many treatments right now. If we catch it early, and we can live, and we can live a great life, but if we wait and we ignore things in our body, then when we catch it, then it's too late.
That's true. And then for those of us who drink a lot of coffee, they told me, well, you know, sometimes the caffeine will cause lumps.
Yeah.
Go to the doctor and let them determine what's really the cause. Because I was told that, well, you know, it just might be from caffeine. No, I don't need you to remind me it might be. We need definite.
Yeah.
So for these ladies to join us this evening and talk about a difficult subject matter, you know, how did your families deal with it while you were going through? It's got to be hard for your families. So, Gloria, what was it like for your family?
Well, I have 2 daughters and a son, and my youngest daughter, when she was 9, she had cysts in her breast.
Wow.
At 9 years old, she'd have an ultrasound done on her breast. So, and at 9 years old, she started her menstrual also. But, you know, they always knew that, you know, I've always kept a check on my breast because, you know, breast cancer does run in my family, but not my mother, my siblings, like one of my mother's, her younger sister.
Right.
She never gave birth to children, so I was always taught in nursing school that if you didn't give birth to children, if you didn't breastfeed, that your risk was higher. So it was devastating to my children, but they, you know, they stood beside me and stuff. You know, one of my daughters, you know, texted me today this morning. Gloria, she's just, you know, got a lot on her right now, whatever. So my mother has dementia, so she didn't really understand a whole lot. She was like, you know, what's going on? And I was making sure, but, you know.
Kim, what was it like for your family?
I would say during that period, of course, I was very young when I was diagnosed. During that time, my daughters they were in their teens, little girls, and me being the only person that was diagnosed with any type of like terminal sickness in my family, it was devastating for everyone. I didn't know anything about it. I called Tamisha. I knew she went through it, and she helped me through the course of the process. And I think just overall, just everyone was just stunned about just the diagnosis. But we got through it, and they came together like soldiers, and we fought through it with no problem. So
that's wonderful. Tamisha, what was it like for your family?
If I can say this, I'm an 18-year survivor, and this subject is still very because it doesn't only affect us, it does affect our kids.
Absolutely.
Yes, it does.
My mother had, what do you call it, the fibrosis. My mother has that. So my mother always had all these little cysts. They would cut them out if they bothered her, but they were never cancerous.
Right.
So when I was diagnosed, like I said, I was ignorant to it because I didn't know if any family had seen anything about it. I called my mom from the doctor's office, and I just blatantly said, "Mom, they said I have cancer." And she lost it. She was just on the floor having a full tantrum. She was having a fit.
Yeah.
And she was blaming herself.
She couldn't believe it.
She felt it was her fault because she has this cyst and she feels like she gave it to me. I had a great support system. A lot of friends. I did lose some friends and people along the way, and I just think they were scared.
The Savior, He will remove them, even when you're trying to figure out, that was my best friend. But they're not supposed to be with you.
That's right.
And that's why.
I was fortunate to have a great support system. I remember my husband, when we first found out, we knew we were going to fight together, but he's always used to me being like Superwoman, right? And thinking that I could just handle everything. And so when the times that he saw me like all the way down, he had to step up, right? And he was there every step of the way. With my sons, I have 2 sons. I didn't tell them for a while. I needed to have answers before I told them because I knew that they would take it really, really hard. And everyone else, like I had so many friends and so many things, and I was able to relax and deal with cancer. And so that was another reason why Fight Right Foundation came into play, because I want a foundation that it gives people, I guess, the advantage of being able to just take care of their health for that period of time, whether it's a year or however long you got to go through this treatment, give you a better chance to fight, because some people have to fight while they're not knowing if they're going to have somewhere to stay or if their lights are going to be on. So I just thought about other people's situation, and I really am grateful to have had the support that I had.
I can only imagine what it's like in cancer and having a support system.
Yes.
I know what it's like in death to have a support system. My son died 3 years ago, and I had that support. It was there to kind of help me along. But when somebody says to one of you ladies, "Oh, I know what it's like," no, you don't. You have no idea what it's like. So sometimes you have to say that to people and say, "No, you don't really know." Because unless you've gone through, you have no idea what this fight is really like.
It's always something that triggers you. You would think about your history, what you went through, your past, and it's just it's a scar that would never go away. It becomes easy, but you would never erase it.
Does it frighten you if there's anything medically happening with you? Are you afraid that, oh my God, what's happening to my body? If you get sick or you don't feel good, how does it impact? Because I know it must, because it's always there with you. So either one of you ladies can talk about it first. Go ahead.
I would piggyback on Tamisha. I think with me being in church and just standing on faith, and I just believe whatever it is, I'm going to be healed. So I try to always think positive, and I barely have any doubts. No doubts.
And I wanted to speak a little bit on that. I don't know if you mind me mentioning, but when she was going through her journey, she was 27 years old, right? And you had your job and you had your insurance, and then you lost your job, right? And then, so you had Medicaid. And what did you think about, like, when you wanted to go and get treatment?
It was scary because I was working a pretty decent job, and my position got outsourced. Our company actually got outsourced. So right around in that same year is when I was diagnosed. So I had to go and get on Medicaid. So it was really scary looking for doctors that would accept Medicaid in such a time as this, where you're willing to go through and fight for your life, but at the same time you're thinking about getting another job to pay your bills, and then trying to find a doctor that can help you.
That's why I said I'm on the patient and family advocacy council at Moffitt, because I don't want people to not be able to go to Moffitt. If we feel like Moffitt is going to save our life, and we do, we should all have that option.
And listen, you all, I want to hold them to it.
Yeah.
If there's any woman out there that you find out you have breast cancer, or you need to get that mammogram and nobody will help you, please call me. That's why you have elected officials in the state of Florida. That's our job. That's our true responsibility, to make sure that no woman should ever have to go through anything by herself and not have the help that she needs. I promise you, I'm one telephone call away, and Dr. Wright knows that I will shake it up for you quick and in a hurry. You will get seen. There's no question about it. They get too much money not to see everybody. And for us, black women, we tend to not go to the doctor like we should. Ladies, don't miss that annual checkup. Please don't miss it. Don't miss your annual mammogram. Don't miss your monthly self-breast check. It's important. And not only women, men check your breast. You might say, well, men don't get breast cancer. It was so ironic. I was on a Zoom the other night, and a young man, when I talked about I was going to be interviewing somebody, a man, he was like, I just got argued, and the lady was on there too, arguing with her that men don't get breast cancer. I say, baby, go back and rethink it. Men get breast cancer. So we have got to encourage our boyfriends, our husbands, not just to get your prostate checked, but also to get your breast examined so that you know you don't have breast cancer. Because it's not male or female, it's anybody. It's not black or white, but for some reason, when we get it, it appears to be a much more aggressive form of cancer.
We will be right back after this station identification.
You are watching The Opening Statement with your host, Dianne Harts, right here on Tampa Bay Television Network.
They are words no woman ever wants to hear.
He said, I'm sorry to tell you, but you have breast cancer.
I was speechless.
A diagnosis of breast cancer changes your life forever.
She told me I needed a mastectomy. I was going to lose my breast.
I was scared.
Absolutely in shock.
But you need to know that you're not alone. There are teams of medical professionals, support groups, and therapists who are all there to help you get through your treatment, and those who can help you plan for life after cancer.
Consult with a plastic surgeon to learn more about your breast reconstruction options.
Breast reconstruction made me feel like me again. Cancer took my breasts, but my plastic surgeon gave them back.
Before you undergo surgery for breast cancer, get the facts. Make sure you know your breast reconstruction options. For more information, visit broaddayusa.org.
I'm Dr. Karen Green. We want you to know your risk. Knowing your family history is life-saving. Talk to a doctor about your family history and see how that history impacts your risk of breast cancer. You and your doctor can then create a personalized plan to monitor for signs of the disease.
My name is Dr. Dianne Guthrie. We want you to get screened. For those at average risk, have a mammogram every year starting at age 40. If there are any signs of breast cancer, finding it early and treating it can save your life. Know you're normal by performing self-breast examinations. It's important to know what's normal for you. So if something doesn't look or feel right, you are able to contact your healthcare provider.
I'm Dr. Miranda Williams. We want you to make healthy lifestyle choices. Living a healthy lifestyle is within all of our control and may lower your risk of breast cancer. Maintain a healthy weight, limit alcohol intake, and exercise regularly. It all matters when it comes to your overall health and risk of disease. Remember to use all of your resources, your local healthcare departments and your local healthcare providers. You can also find valuable information at Komen Breast Care Hotline. That's Komen, K-O-M-E-N, 1-800-GO-KOMEN. Also, follow up with cdc.gov.
Now, on with the show.
The doctor and I talked about some things that he's doing, some type of tracing and some other things, trying to determine why is it so much more aggressive in black women.
And just like everything else, when this is more aggressive in black people, that's not by accident. We are 40% more likely to die of breast cancer than our white counterpart. Those numbers have to change.
Yes. Because if we don't take part in trials, then we don't get to know why something attacked black women more. But if the COVID did nothing else, It taught us that we're underserved in whether it's in healthcare, housing, jobs, insurance, everything. We died at a much higher rate than anybody else during COVID. But ladies and gentlemen, we must. Even if you don't have insurance, many of you all may not know that Tampa Family Healthcare, right there on the corner of 22nd and Osborne, Mr. Cole, who just passed away about 10 days shy of his 100th birthday, fought to bring that clinic to your community. I can go to any doctor I want to, but I go to the clinic. And you know why? Because I want to know, how do you treat everybody? I didn't walk in and say, oh, well, by the way, I'm representative. No, I went in and said, I'm Dianne Hart, and I want to come to this clinic. So I know that there's money available to the clinic, that they can see any one of us, whether you have insurance or not. So we have no excuses why we don't go to the doctor. And we need not always go to the emergency room. We need to find ourselves some doctors and go to them.
That's why we brought the well to the community as well, just for more access. We're right here in East Tampa.
That's right.
And we're able to, we're going to have doctors here, and we're going to have a one-stop shop where you can come and get your, see your doctor, get your prescription. And with Fight Right Foundation, we're going to look for some funding so that we can do things like fund mammograms and have these kind of health fairs that from people that look like us, who's been through, because people see me and they're like, oh my gosh, like, you don't look like you have cancer.
None of us know what it looks like. These ladies know what it feels like. They know what it is to endure it and go through it, for all of the treatments and all. And for all of you all out there, though, who have gone through, you need to connect with the Fight Right Foundation. This is an organization to pull all of our women together. And I know that it's not based on color, and I want to make sure I say that. It's not about just being black, but we typically don't have the necessary resources to have an organization like this. So it's important that we have somewhere for our black women to be able to go. Most other ethnic groups, they have the supports that they need in place already. Well, I want to thank you ladies for joining us this evening. The month of October was Breast Cancer Awareness Month. We must take one show every single month, and it's got to be talking about breast cancer. Because unless we talk about it, nobody's coming into our neighborhoods to discuss it. So it's up to us to talk about our health and our healthcare needs. And not just our breast cancer, ovarian cancer, all of the various things that attack us more. High blood pressure. It's a silent killer that's killing our people in our community every single day. But nobody's talking about it. So we've got to be the people talking about it. But moving forward, ladies, every single month, I am honored to have you all. Let's sit down. Let's have a conversation about what's going on in your lives, what your children doing. We can talk about nothing, but we're going to always remind our women. You must, ladies, take care of your health. You want to be here for your children. I got a call a few days ago. A mother passed away. She had 2 children, an 18-year-old and a 16-year-old. Her babies did not know that she was that sick. She was at home when she passed away, but they had no idea that she was that sick. My niece died from cancer, and she never told her children. Her oldest was 14. She would say, I'm going out of town. When she went over to Moffitt for her chemo, and I stayed with her, she would have to take an aggressive chemo, and it'd be like 2 days. She'd have to stay in the hospital to get it. So I would go every time, and we would never tell anybody where she was. So we've got to get out of the notion that we don't want to share. By sharing, we're showing that we care and that we can help somebody else. And that's what we've got to do. So thank you all so much for watching the opening statement. I look forward to seeing you all next week. And Miss Linda Walker should be my guest for next week to just kind of talk about that journey and what it's like to be incarcerated and then to come back home to face the real journey, how life has changed. So thank you all for watching the show. We look forward to seeing you next week on the opening statement.